I was responsible for implementing security, but they were oversight, governance, and those kinds of things within the organization. But I've also seen the CISO underneath the CIO as well. Is there a better reporting relationship for security within IT?
I think, Bill, I've been asked that many times, and I have talked to many CEOs about this question. Where should cybersecurity report? It falls in every healthcare organization that I've talked to at CEO, CFO, CMO level. It falls high on the risk list. It's number one, number two, number three of every organization's risk inventory. That doesn't mean that there's a good or a bad model. I think the good model, Bill, comes down to how is the organization structured? And so as I talk to organizations, I don't see a magic model, but what I do see is you need to understand there are decision makers, there are leaders who are making things happen in the organization. Cyber has to be tied into that environment. And it may or may not mean that you shifted. There are pros and cons, and I have looked at 5 or 6 models, from reporting it into finance, reporting to the COO, where all the nurses, the physicians, that COO model. There's the legal model. There are numbers of different models, compliance and privacy model, where it could effectively report. What has to happen is that healthcare cybersecurity has to become an enabler and not a barrier. And today, many times when it gets lost in an organization, whether that's under the CIO or whether it's up under legal, whether it's over under finance, if cybersecurity gets disconnected, then the cybersecurity leader starts to feel anxious, threatened, and starts to push an agenda that oftentimes becomes a barrier and not an enabler.